I'm one of the most experienced physicians or urologists with this machine, and as a matter of fact, I'm a proctor. I teach other physicians how to use it. It is a machine. It is a technology where we use a laser, a very high-powered laser, to create a channel for men to urinate through. When you have an enlarged prostate and you don't respond to medication, or you have side effects from the medication, or can't afford the medication, the surgical option sometimes is the next step. And there are other minimally invasive treatments available, but still one of my favorite ones is the green light. It is very elegant because it causes an immediate opening of your urination channel. So there's an almost immediate improvement noticeable after the surgery. And it is an outpatient treatment. You go home the same day, as compared to previously when you had the scraping, or very crudely called the rotor-rooter. You'd be in the hospital several days. You would have had bleeding. You would have a catheter in, a tube draining the bladder for several days. Right now with the laser, there's a good chance that you go home without a catheter, and that you have immediate improvement with minimal or no blood loss. And you do the same thing as the old-fashioned gold standard rotor-rooter treatment. So I'm a big proponent of it. And as a matter of fact, I had it on the previous radio show that a patient had heard of me with this machine, and he came to my office and said, well, my urologist says I have a very large prostate, and he might have to do it as a staged procedure because there might be so much bleeding, and that he has to stop, and then a couple of days go back in and resume it. And
we're talking torture here.
Well, kind of exactly. So I said, well, with the laser, you don't have that problem usually with the bleeding and everything, and you wind up doing this large prostate in one time. And we did. And he's a very happy man. He's urinating like an 18-year-old and emptying his bladder, and, all done outpatient.
That is amazing.
Yeah. So
well, he's got to feel like he avoided a lot of problems there.
Exactly. So that is the state-of-the-art treatment nowadays available.
Is this something that perhaps the other doctor was unaware of, or just not trained to perform, so he was just going to his best line of defense?
Exactly.
Wow.
It is a fairly new technology, and also a somewhat intricate technology, and especially with very large glands. With very large glands, in the past, what we used to do is do an open prostatectomy, as we call it. We made an incision and actually get to the prostate, peel out the prostate, close the bladder and everything, and you would be in the hospital 7 to 10 days. And the rotor-rooter was only reserved for smaller prostates because there was a limitation on operative time. And nowadays with the laser, you can do the same procedure on these larger prostates on an outpatient basis in most cases.
Wow, that is some kind of tremendous. All right, here's something else that was never talked about publicly until maybe about 10 or 15 years ago, and then it became a laugh line in a lot of comedies, but it is something we need to take very seriously, and I know that we will on this show. Impotence. But again, never discussed. And I guess there's generations of men who could have had a normal sex life but would never go to the doctor.
Exactly. It is an embarrassing subject, Everybody's talking about it and laughing about it, and it is very embarrassing. And in the past, it was thought that 90% of the erectile dysfunction, as it's called very nicely, or impotence, is due to psychological causes. We now know that it is 90% physical causes.
90%?
Yeah. More than 90% of the erectile dysfunction or impotence is due to physical causes.
Now, here again is a part of the show, Doctor, where we want to underline women need to understand what's going on with their man. Exactly. Because how many women have felt dejected, especially in their 40s and 50s, and feel like, oh, I've lost my looks, I've had the children, he works hard, he works around those beautiful secretaries all day, and I just don't turn him on anymore.
Exactly.
Is that right?
And that is exactly the
and that's not it.
Yes, that's not it. It is most often physical causes, most often vascular causes. And as a matter of fact, it is a very common problem. We have a rule of thumb. We have a rule of thumb that at age 30, 30% of the men will experience erectile dysfunction. At age 40, 40% of men will experience erectile dysfunction. So at 50, et cetera, et cetera. So it is a very common problem. And at the same time, in many cases, easily treatable. And some cases, you may be a little more invasive, but almost 100% treatable.
Okay. And when you say vascular, so we're just talking about the flow of blood?
That's correct. That's the most common problem. It is most commonly a decrease in the blood flow. And we cannot really open up those vessels because those vessels are microscopic, very small. But we can try to increase the blood flow with medications or sometimes with other means and try to increase the blood flow. And that is, in most cases, more or less 7 out of 10 cases, it is treatable that way.
Is diabetes and the growing rate of diabetes affecting the vascular?
Absolutely.
Very much.
Diabetes affects not only the blood flow. It not only affects the blood vessels, hardening of the blood vessels and closing of the blood vessels, but also the nerves. Sexual impulse is, both neurological. The nerves have to work, and that is why with the prostate surgeries for prostate cancer, we talk so much about nerve-sparing surgery or nerve sparing the nerves, and also a vascular event. It is both, and diabetes affects both the nerves and the blood vessels. So diabetics actually get a very raw deal as far as that is concerned.
Now, medications that are so advertised, you can't turn on the TV without hearing an ad for Viagra, or there's 2 or 3 others. Are those just temporary masking the problem or demasking the problem? Then you still need to have something permanent done through a urologist?
No, not necessarily. You're not necessarily masking the problem. The problem is there. And you cannot really make the problem go away, but you can overcome it. Basically, what you do is you improve the blood flow with these medications, and then you return to normal function. There are 3 oral medications officially available, Viagra, Levitra, and Cialis, and they each are somewhat related to each other, but they do differ in the sense the most common or the differentiation is the time that they work. Viagra is relatively short-acting. Cialis is relatively long-acting, but they all do the same thing. They improve the blood flow to the penis.
Now, in as much as they're improving the blood flow to the penis, are they also improving blood flow to other parts of the body? I mean, with not the same result, but...
Yes, they do. There's actually a somewhat funny story about Viagra, the way that Viagra was found. Viagra was known to improve the blood flow, and it was apparently developed to try to improve the blood flow to the heart. And they started treating patients for heart disease with Viagra.
And all of a sudden the patients are calling the doc smiling.
Exactly. Patients started, didn't want to, reported that they got better erections. And apparently the results for the cardiac part were somewhat disappointing. So they started developing it more for the erectile dysfunction. There are also some other effects like in the face. That's why you can get the flushing, that you can get improved blood flow to the face, and that causes the flushing. So,
you also see advertised, but I don't necessarily know if they've been FDA approved, but you see a lot of these things that say normal herbs to try to do the same thing. Is that possible?
Herbs are not controlled by the FDA, so we don't really know what's in them. And I have to warn people about that because you don't really know what's in them. And in a study that was done outside the United States, they actually found a lot of poisons and toxins in these things. Great. So you have to be very, very careful about taking these things. However, there's a big market, and many scrupulous people are advertising these things. And of course, it is somewhat cheaper than the real medication. So, in many cases, I say, well, first of all, you don't know what you're taking. Second of all, sometimes you can certainly try them. If it works, well. If it works, fine. If it doesn't work well, then you can stop. However, I do have to forewarn that in certain studies, we found a lot of toxins in there and heavy metals.